Hello there, my name is Chessie Reiner, and this is my geriatric syndrome case study presentation done on osteoporosis. What is osteoporosis? A skeletal disease characterized by low bone mass, deterioration of bone tissue, and disruption of bone architecture that leads to compromised bone strength and increased risk of fracture. It can be classified by loss of too much bone, your body making too little bone, or it could be a combination of both. Osteoporotic bones have decreased density or mass and contain abnormal tissue structure. Osteoporosis is the most common chronic metabolic bone disease and is most commonly seen in older Caucasian women. There is estimated more than 200 million people suffering from osteoporosis. According to recent statistics, 1 in 3 women and 1 in 5 men over the age of 50 will experience osteoporotic fractures in their lifetime. Older adults with osteoporosis have an increased risk for falls and fractures, so there is great significance in understanding this disease to prevent complications. Injuries and the disabilities related to osteoporosis, admissions to hospitals, nursing homes, and long-term care facilities are burdening the healthcare systems due to significant costs associated with care and treatment. Nurse practitioners must assume these key roles and enhance their knowledge of osteoporosis through education regarding bone health. The patient in this case study denied any food or medication allergies, but does report having seasonal allergies. I've listed below the current medications that she's taking. She reports receiving all of her childhood immunizations and being up to date on all current immunizations, including her annual flu vaccine and pneumonia. This patient is a 77-year-old African American female who is seen in the office to review lab results, complete her annual history and physical, and also refill her medications. Today she reports bilateral shoulder pain that has been going on for several months now. She rates the pain as a 3 out of 4 and describes the pain as throbbing. She states the pain is intermittent. She also has a history of back pain. In osteoporosis, typically there are no symptoms in the early stages of this disease, but back pain, loss of height, stoop posture, and bone fractures can be found. This patient's pertinent medical history includes diabetes, hypertension, morbid obesity, DVT of the lower extremities, chronic kidney disease, stage 2, hyperlipidemia, pulmonary embolism, blood coagulation disorder, and osteoporosis. She denies any hospitalizations beside a cholecystectomy and mastectomy. She lives with her husband in a single-family home in West Palm Beach, Florida. When going over this patient's review of systems, the only problems that she complained of were some mild fatigue, muscle aches, joint pain, and the shoulder pain that began a few months ago. It is our job as future nurse practitioners to empower our patients and encourage them to participate in healthy activities and make changes that will decrease their risk of developing chronic medical conditions. We can encourage weight-bearing exercises, a diet high in calcium, vitamin D supplements, limit alcohol consumption, and encourage smoking cessation for these patients. I also promote health by empowering her to do at-home blood pressure checks and daily blood glucose sticks. By doing this raises awareness of her disease process and makes her feel more involved in her own care. We can promote prevention by providing education to our patients and encouraging the use of vaccines and screenings. It is important to monitor my patient's labs every 3 months to closely watch for any changes in her medical conditions. Staying up to date on dental visits, screenings, mammograms, DEXA, and eye exams will also help prevent further decline and decrease the risk of developing further complications. The most For the most part, this patient's physical exam was normal, except for we did find some weakness in her lower extremities. This patient does use a walker for ambulation, so because of this, we decided to do a couple of screening tools to check for fall risk. The screening tools I've used is the home safety assessment checklist, which showed that she is a moderate risk for falls. The mini mental status exam, which showed no cognitive impairment. The balance assessment tool, which indicated a low fall risk with the provider and a moderate risk when she ambulated by herself without her walker. The geriatric depression scale, which showed no signs of depression. For diagnostics for this case, a DEXA scan was done 2 weeks prior and an x-ray was done to rule out any fractures. Labs, we completed a CBC, a CMP, a thyroid panel, a lipid panel, hemoglobin A1C, and urinalysis. For the treatment of this patient, calcium, vitamin D, and a biophosphate is the first-line treatment for osteoporosis. This patient is already on alendronate, and she is also taking vitamin D3, but I also might consider starting her on a daily calcium supplement as well. Her diabetes, hyperlipidemia, and hypertension is very well controlled on her current regimen, so no other changes will be made at this time. I will continue to see her every 3 months for labs and make sure she is up to date on screenings, such as DEXA. I will also encourage weight-bearing exercises for 30 minutes 3 times per week and also refer her to physical therapy as well to help with muscle strengthening. The differential diagnosis I picked for this patient was fractures, which was ruled out with an x-ray, adhesive capsulitis, which was ruled out with the exam, osteomalacia, which was ruled out by DEXA x-ray and lab results, and muscle strain, which was ruled out by the exam because her symptoms were not muscle related. The final diagnosis for this patient was osteoporosis with arthritic shoulders. The patient had a DEXA scan 2 weeks ago prior to this visit, which showed her diagnosis of osteoporosis. DEXA shows the amount of x-rays absorbed by tissues, and bone is measured by the DXA machine, which correlates bone mineral density. As common as osteoporosis is, it is very often underdiagnosed and undertreated. Other barriers to care are other conditions that can stem from osteoporosis, such as fractures of the spine and hip, chronic pain, deformity, depression, disability, and even death. About half of patients with hip fractures from osteoporosis are left permanently unable to walk without assistance, and others will require long-term care. Another challenge to the plan of care is patients not taking their medications correctly, whether it's not enough or them just not taking their medication at all. It is important that this patient and other patients know about their disease and where to find help if they need it. The National Osteoporosis Foundation is there to help provide support to any patient affected by osteoporosis. By encouraging these patients to work with others, they can learn more about how to prevent, diagnose, and treat osteoporosis. I have listed 3 links below in this PowerPoint for support groups on osteoporosis. Interprofessional care is essential in today's society and helps ensure patients are receiving the highest quality of care possible. Interprofessional care closes communication gaps, increases collaboration, and promotes interaction among medical professionals to maintain continuity of care. My patient in this assessment has multiple health problems, which requires collaboration from all healthcare providers, including physical therapy, cardiology, and ophthalmology. This interprofessional approach helps provide her with the best possible treatments. The health behaviors identified in this case study consist of multiple medications, dizziness, muscle weakness, and joint pain. These factors place her at risk for polypharmacy, falls, injuries, and visual problems. The social determinants for osteoporosis were obesity, age, sex, socioeconomic status, and comorbidities such as renal disease, diabetes, hypertension, lack of exercise, and she doesn't follow a proper diet. In today's society, it is extremely important to provide culturally competent care. Increasing your cultural knowledge and communication skills among other cultural groups improves patient comfort and satisfaction. In Florida, there is such a diverse group of patients that we see each day. As a future nurse practitioner, I must make it my goal to expose myself to different cultures to create positive cultural encounters with these patients. One ethical and legal aspect that was important to me in my patient assessment is advance directive. My patient in this assessment did not have a living will or advance directive specifying the type of care she would like to receive. She was not interested in setting this up for herself. As a practitioner, we can only point out the positive aspects and provide supportive suggestions when it comes to legal and ethical issues. One thing I learned through this research is that osteoporosis is not a systemic or whole body disease, but an indication of where your bone is not loaded correctly. The error margin is too high with in-office bone screenings, so DEXA is the most valid test to give you the diagnosis. To obtain optimal bone regeneration, you need to keep your bones holding the proper amount of weight to initiate the greatest response in the bone growth signaling cells. Over the next 3 slides, I have listed the references that I've used for this PowerPoint presentation. I hope you enjoyed my presentation on osteoporosis, and this concludes the presentation.